All right, let's switch away from biological treatments and let's talk about counseling, so psychotherapy for depression. There are dozens of different types of psychotherapies. I've listed here the ones that you will most commonly hear about. Supportive therapy, cognitive behavioral therapy, also known as CBT, interpersonal therapy, and then psychodynamic therapy. I'm going to illustrate cognitive behavioral therapy in the context of anxiety disorders, but we're going to talk about psychodynamic therapy right now. I'm going to give you a case example of how it works. So the principles of psychodynamic therapy is that people's problems stem from early childhood attachment, primary relationships with their parents, unmet needs, neglect, abuse, those types of things. These problems in the relationships with the primary caretaker end up shaping this image that a person has of themselves, and they're transferred as they get older from their parents, often to current relationships. And they're individuals who kind of relive the same dysfunctional relationship with a significant other as they had with their parents. And the problems can also be displayed in the relationship between an individual and his or her peers and his or her employer. So it's not just to the significant other. The behavior or the depression is a solution to address the unresolved conflicts stemming from the problems and the dynamics of the relationship between child and parents. So one thing you hear about is people saying, look, you're 45 years old, but you're still living in the past 40 years ago. Come on, man, grow up, grow out of it. However, I like to show this image of Konrad Lorenz with all these little geese following him. This is an example of imprinting. So as a baby is born and its brain is developing and it realizes it's got a caretaker, someone taking care of him or her, and the brain develops with that imprint of the primary caregiver. With humans, the brain develops over 25 years, and during the first 18 years, it's all about family. So this is imprinted into our brains. It's an evolutionary process that helped keep the parental-child bond up until the child would grow up enough to be able to leave the parents. So it's not that easy to forget what happened 40 years ago. It's imprinted in your brain for life. Psychodynamic psychotherapy, here's the intervention. The therapist conducts a thorough exploration of the person's childhood experience, current and past relationships, both with friends, significant others, employers, etc. The individual is helped to develop insight into their own narrative, their concept of who they are, and to understand their current behavior and what its origins are. This explanatory model for the patient's illness helps the patient develop some compassion for himself or herself, and also permits a certain degree of freedom from the kind of script that was embedded in their brains during childhood. Transference is when an individual takes feelings that were aimed towards the parents, and now as an adult, the individual transfers a lot of those feelings to the parents over to the therapist, because after all, the therapist is kind of like an imitation caretaker. And the transference can be used as a laboratory wherein the therapist can discover how does this patient relate to other people. Also in psychodynamic therapy, the therapist usually shows positive regard for the patient, and that mirroring helps the patient heal from past experiences of neglect and abuse. So here's a case example of a patient of mine. Bob was a 22-year-old senior at University of Chicago. The primary care physician referred him to me for an evaluation of spells in which he becomes mute in social situations. He had sleep problems, poor self-esteem, depressed mood, lack of interest or pleasure, problems concentrating, and also passive suicidal ideation. Early when I met with him, he revealed intense preoccupations with a high school classmate whom he views as a successful rival. He's enraged by thoughts of Abe succeeding. And he's compulsively checking his Facebook page to learn of Abe's achievements, despite having had no personal contact with Abe in over 4 years. So Bob's childhood history was noted for a father who was a successful lawyer who competed with Bob at an early age and had no tolerance for Bob's achievements. I remember him telling me that he would play chess with his father as he was growing up, and the first time he beat his father, the father stormed out of the room and never wanted to play chess again with him. That's how bad it was in this kid's family. When Bob got into basically the Harvard of the Midwest, University of Chicago, his father, who was a Harvard graduate, dismissed it and said, well, U of C is no Harvard. So this is the kind of verbal abuse and emotional abuse that Bob underwent during these imprinting years of childhood. It became clear that Bob's envy towards Abe was about the pride expressed by Abe's parents, which were in contrast to the intolerance of his father to his own achievements. Bob was not aware of the anger towards his father. He spent a lot of time trying to appease him. He would send his father little gifts, little notes. When on spring break or winter vacations, he was obsequious towards his father, trying to curry favor because, of course, achievements, academic achievements, resulted in the opposite emotion. In other words, the father would be dismissed or angry. So the major crisis occurred whenever Bob performed well in his classes. He purposely tried to flunk out of classes by not doing homework and by defying his teachers. At the same time, he'd call the teachers later on, express tremendous shame at not having fulfilled his academic responsibilities. Similarly, he could not allow himself to win in social environments where there's competing amongst different people to lead the conversation. So he would be with a bunch of people and he would just become mute so that he didn't have to compete with anybody. With me, he skipped therapy appointments and then say he must be one of my worst patients. He wouldn't take the medications. He was afraid that if his mood improved, I wouldn't want to see him anymore. So you can see the transference of the relationship between him and his father is leading to academic failure, social failure, and even failure in the therapy because he's missing therapy sessions and he feels like I won't like him anymore if his mood improved. So his depression was conceptualized as a result of conflict with his narcissistic father. If Bob wins the competition, he loses father's affection and he feels very guilty. If he loses the competition, he's enraged, but the father is happy. So the anger towards the father is unacceptable to him. He's unaware, completely unaware of it, and depression becomes anger turned inwards. The solution for him was not to compete with people, so be mute in social situations, skip classes, get poor grades, find other ways to secure father's affection. Often he would feign illness, like these spells, for example, he thought was a medical problem. So sharing medical problems with his father, he felt was going to gain father's affection. Failed relationships, obsequious behavior, and unemployment would all secure the bond between him and his father. Instead of getting angry at father, he would get angry at surrogates. So Abe, that boy in his class in high school, he also would be enraged with the university and would constantly be lambasting the University of Chicago. And when he had an employer, he viewed the employer as narcissistic, unrelenting, unforgiving, and not recognizing his contributions. So through insight, he was able to see his spells as actually behaviors that were under his control. He was able to explain and predict the irrational feelings and behaviors he had towards academics, social situations, and even with me. Through the anchor of the relationship with me, he stopped acting out by missing sessions and he started taking his medications. He got a job as a journalist and held on to it. The mood improved, the spells diminished. So that's an example of psychodynamic therapy that worked. This took years and years of therapy for him to get to the point where he is now, which is essentially living with the woman he's going to marry. He's got a job that he's been able to be very successful at, and he's been able to hold for several years. Many studies show that psychotherapy is equally efficacious as compared to medication, particularly for moderate depression. When we start getting to severe depression, medication becomes more and more critical. And there are studies showing that the combination of psychotherapy and medication is actually more effective than either alone. I've just showed you one type of psychotherapy now, and when we talk about anxiety disorder, we'll be talking about another type of therapy, cognitive behavioral therapy. But there are really dozens of different types of psychotherapy. And one of the main components in a successful therapy is the relationship of the therapist and the patient. And that will conclude our discussion of psychotherapy of depression.